Good morning everyone. Welcome to KNO Academy YouTube platform. Today we will discuss some of the rapid questions on Parkinson's disease. Okay, we will move to the questions. First question is Parkinson's disease is marked by lack of which chemical in the brain? He is asking questions. Which chemical deficiency going to cause Parkinson's disease? Here the options are: first one is serotonin, second one GABA, third one is dopamine, fourth one is acetylcholine. We'll discuss all four these questions. Okay. First, acetylcholine. Acetylcholine is one of the neurochemical, but please remember deficiency of acetylcholine will cause myasthenia gravis. Okay, or myasthenia gravis. Please remember, it is one of the disease condition in which the patient is suffering from deficiency of acetylcholine. It will cause myasthenia gravis. Okay, next we will move to GABA. GABA full form is gamma amino butyric acid. Deficiency of this GABA leads to anxiety. What? Anxiety. It is in a neurotic condition. Okay, or it is in a neurosis condition actually. Okay, deficiency of gamma, it is an inhibitory hormone which is secreted in the body, gamma amino butyric acid. Okay, next serotonin. Serotonin, what exactly causes? Deficiency of serotonin will cause a depression. It is in a psychotic disorder. Okay, it's in a psychotic disorder. What? Psychotic means psychosis. It's a deficiency of serotonin will cause depression. Deficiency of GABA will leads to anxiety. It is a neurotic condition. Deficiency of acetylcholine, it will lead to myasthenia gravis. It is a neuro where acetylcholine will decrease, means it is a neuromuscular junction, NMJ. Okay, then at last answer is dopamine. Deficiency of dopamine, it leads to Parkinson's disease. Okay, lack of dopamine, it leads to Parkinson's disease. Okay, if dopamine is increased, means what will happen? Answer this also. Okay, na, increasing the dopamine secretion. Okay, increasing in the dopamine secretion leads to schizophrenia. Okay, schizophrenia. Schizo refers to split. These are the extra points I am discussing. Okay, phrenia means mind. Split minded is present in the schizophrenia patients. Okay, answer is dopamine. Lack of dopamine, deficiency of dopamine in the brain, which leads to Parkinson's disease. Okay, client diagnosed with Parkinson's disease and ask the nurse what is the cause. What is the cause of Parkinson's disease? Nurse's response is disintegration of the myelin sheath, breakdown of the corpora quadrigemina, reduced acetylcholine receptor at synapse, and degeneration of the neurons in the basal ganglia. Okay, we'll discuss one by one options. Disintegration of the myelin sheath will act as an insulation. Otherwise it will help to transmission of an impulse as early as possible, like this jumping pattern. Disintegration of the myelin sheath, disturbance in the myelin sheath, it leads to multiple sclerosis. Okay, not Parkinson's disease. What? Multiple sclerosis. Please remember this. Okay, in multiple sclerosis what happened means descending weakness will happen. Okay, descending muscle weakness will happen. What? Descending muscle weakness will occur. Please remember one trick I will give. MSD. M means multiple sclerosis, descending muscle weakness. Like this GBS, Guillain-Barré syndrome, in this ascending muscle weakness will happen. What? Ascending muscle weakness. Okay. Next options. Breakdown of the corpora quadrigemina. What actually corpora quadrigemina? It means corpora quadrigemina is a bump like a structure which is present in the midbrain. 4 bump like structure which is present in the midbrain. It will help in the visual activity. Okay, we will not going to the answer for this question. Okay, and next option is reduced acetylcholine receptor at synapse. Synapse, what synapse actually means? Like this, if two neurons meet each other means it will going to called as a synapse. Okay, in these options what they are going to tell me, reduced acetylcholine, decreasing in the acetylcholine will leads to what? Myasthenia gravis. Previous slide only I explained. Okay na, myasthenia gravis. Okay, moving to the last option, degeneration of the neurons in the basal ganglia. Okay, this is the answer. What actually happen in this Parkinson's disease means there is one organ named as basal ganglia. Okay, in this our neurons are degenerating means automatically dopamine secretion, dopamine store, dopamine functioning will disturb. That's why there is any disturbance in the basal ganglia means automatically it will cause Parkinson's disease. This is the answer we are going to response. Okay, basal ganglia you take. In basal ganglia only D2 receptors are present. Okay, substantia nigra. What substantia nigra? It is an anatomical, not an anatomical, it is a functional organ which is present in the brain. Okay, please remember this. Basal ganglia, D2 receptor, substantia nigra and midbrain. Okay, here dopaminergic site. Substantia nigra will prepare dopamine, sent to the midbrain, because in midbrain only the dopaminergic site is present. After that it will go to the basal ganglia. Automatically if the basal ganglia damaged means there is no secretion of dopamine. That's why that answer will going to degeneration of basal ganglia leads to Parkinson's disease. But in basal ganglia there is a D2 receptors present which will help to uptake of a dopamine chemical that will help to maintain the balance in the body. Okay na, it's the answer. Okay, these points you remember. Next we'll move to the next questions. A nurse intervening a client, how the Parkinson's symptoms onset occurs. The examiner is asking this question is that it's a nurse, a healthcare provider intervening a client, how the Parkinson's symptoms will occur in the patient. First option is suddenly, second is gradually, third overnight, fourth irregularly. Parkinson's symptoms are not irregularly, it will be continuously. There is no pattern like irregular, it will come and it will go, it like a light off, light on, like this not happen. It will, these symptoms once onset means it will occur throughout the life, end up in a life. It's not an option. Next, suddenly it will not occur suddenly. It is suddenly means it will going to an acute condition, but Parkinson's disease is not an acute condition, it is a chronic condition. How these symptoms are occurring suddenly? It is also not options. Please eliminate these two. After that, overnight, automatically one night these symptoms will occur and patient is suffering from Parkinson. This type of miracle will not happen in the overnight. Okay, this also eliminate. Gradually occurring. What? These symptoms are occurring gradually, slowly it will occur. Okay, slowly occurring of symptoms. Okay, the answer is Parkinson's symptoms are occur in gradual manner. Okay, what is often the first symptom of Parkinson's disease? Okay, what is the most common first symptom of Parkinson's disease? Okay, first option is rigidity, flaccidity, shaking of the hand or foot, repeatedly turning of the head. Repeatedly turning of the head. It is not a clinical manifestation of a Parkinson's disease. Only we are seeing the 4 characters. That is R, B, G. T means tremors, R means kinesia, gait disturbance. These only 4 symptoms we are seeing in the Parkinson's disease. Okay, but what examiner asking is what is the first symptom will occur. This manner only it will occur. Onset of a disease. In this order only it will symptoms will occur in this Parkinson's patient. Okay, now please remember this order. TRBG trick. Okay. Rigidity. Rigidity also one of the symptom, but it will not occur in the first. Na. What rigidity tells means? What rigidity actually means? The muscle become very stiff. Okay, stiffness, inflexible. Okay, what we are going to call inflexible. Okay, na. It will not going to answer. It is also one of the symptom, but it will not first symptom. Okay. Next we will flaccidity. What flaccidity means? Answer flaccid paralysis you heard na. That only this word denotes flaccidity. Loss of a muscle tone. What? Loss of muscle tone. Unable to contract the muscle. What? Unable to contract the muscle. Okay. Next, it is also not flaccidity not at all occur in the Parkinson's. Rigidity will occur, but flaccidity never occur in the Parkinson's disease. Okay, na? Shaking of hand or foot. This is the answer of our question. Okay, this is tremors. It will denote to tremors. Indirectly, it will examiner going to say it is a tremors. Okay. Next, repeatedly turning up. It is not a clinical manifestation of Parkinson's disease. Answer is shaking of hand and foot. We will move to the next question, 6th question. Okay, the 4 cardinal symptoms of Parkinson's disease include. What are the 4 cardinal? 4 cardinals. It is important. Picks. Okay, cardinal symptoms of Parkinson's disease include. What are the symptoms which include in the Parkinson's disease? Okay, we will move towards options. First one is tremors, bradykinesia, dementia, rigidity. Bradykinesia means brady refers to slow, kinesia refers to movement, slow. While doing an activity, automatically in the Parkinson's patient, there will be a slow in the work process, slow in the movement process. Okay, first tremors, bradykinesia, dementia and rigidity. Okay, these tremors, bradykinesia, rigidity we heard, but dementia will not occur in the Parkinson's disease. It is not a cardinal symptom. Okay, dementia, no, it is a memory disorder. Occur in old age. Okay. Next, option number 2, tremors, bradykinesia, rigidity and postural instability. Okay, what is mean postural instability? Okay, postural instability means positional. Postural refers to positional. Gait disturbance. What? Position gait disturbance occur in this patient. Actually, it is the answer for this question. Actually, what? Tremors, bradykinesia, rigidity, TRBG. Na? This is only TRBG. Here we will come to these options. Tremors, bradykinesia, seborrhea. Seborrhea not at all occur. Seborrhea is it refers to infection upon scalp. Okay, infection upon scalp. This type of findings are not occurring in the Parkinson's disease. Okay. Next, gait disturbances will occur, but seborrhea is not occur. Here the examiner changed the sentence, send the word to confuse. Postural instability he kept. Okay, don't confuse. Next, tremors, bradykinesia, rigidity, depression. Depression will never occur in the Parkinson's patient. Okay, na? Answer is option number 2. 7th question. A client with a diagnosis of a Parkinson's disease asks the nurse to why I do drool so much. What is the nurse response? Patient is asking, Parkinson's patient is asking to healthcare provider, why I am going to drool so much? What is the reason? What is the nurse's response? Okay, drool means saliva, saliva drooling, excessive. First option. We don't know why this is happening. Nurse's response. It's not a good response. It will not going to an answer for this question. There is a paralysis of the throat muscle. No. Any recent study, any research studies will not going to tell in Parkinson's disease there is a paralysis in the throat muscle that will lead to drooling. It is not an answer for this question. Okay. The next, muscle rigidity prevents the normal swelling. No, Muscle rigidity happen, but it will not occurring in the throat muscles. It will not occur. Okay, na? It will not an answer to that question. We have a loss of an involuntary movements. Okay, this is the answer. Okay, what means basal ganglia? I will discuss. Okay, basal ganglia will helps to automatic associated movements. It will controlled by basal ganglia. Automatic associated movements. It will controlled by basal ganglia. What are the automatic associated movements? Blinking of the eyes, okay, swallowing of the saliva, okay, swallowing of the saliva, swinging of the hand while walking, swinging of hand while walking. Okay, these are the involuntary movements will controlled by basal ganglia. Okay, but in Parkinson's disease, automatically basal ganglia affected, basal ganglia damage means these are the activities will not occur, disturbed. You are having the not control on swallowing. Okay, that's why you are drooling too much saliva. Approximately 1 to 1.5 liters saliva production in a day will occur. Automatically you are not getting a control on that, means it will automatically drool, salivary will occur. That's why that is a damage in a basal ganglia leads to a disturbance of automatic associate movements. This is the options. Okay, we have loss of involuntary movements. This type of response you should give to the patient. Okay, we'll move to the next question. There are a dash stages of Parkinson. How many stages of Parkinson's disease? First options, second stage, fourth stage, fifth stage, seventh stage. We'll discuss the stages. Okay, stages of Parkinson's disease. Okay, stage to stage, only total 5 stages are there. Okay, but stages of Parkinson's disease is given by Wen and hair. But Wen and hair, these two persons are given the stages of Parkinson's disease. Okay, stage 1, what will happen means tremors will occur and shaking of the one side of the body. In stage 1 Parkinson's disease, what will happen is firstly patient is suffering tremors. After that, one shaking of one side of the body, one side of the hand, one side of the leg. These extremities will shaking will happen in first stage. Next, in second stage, what happen? Tremors and shaking of the one or both side of the body. Stage, it will progressing the disease. Okay, na. Tremors also occur, but shaking of the one side and both side of the hand. In stage 1, only one side of the hand. Stage 2, both side of the hand. Okay. Next, stage 3, balance impairment and slowing of motion. Okay, patient is not able to maintain a gait, not able to maintain a balance, and not able to finish the work within a correct time. Slowing up in a motion, bradykinesia. Indirectly, answer is bradykinesia. Okay, these are occurring in stage 3. Okay, in stage 4, what happens means disability and need assistance. Disability, in this what happens means the patient is not able to do activities of daily living. What activities of daily living? Okay, this is a 4 stage, and automatically the patient is not going to do activities of daily living, but patient need an assistance, na? So in the 4th stage, patient need assistance. Okay, stage 5th, patient may bedridden, wheelchair, and need a constant care. In automatically disability will disability will progress to bedridden, and patient is not able to move out of the bed, move out of the wheelchair, always need a wheelchair, always need a constant care. These are the stages of Parkinson disease given by Wen and Yar. Okay, we'll move to this question. Okay, answer is third. 5 stages of Parkinson's disease. Which of the following is recognized an initial cardinal sign present in early in a Parkinson's disease? What examiner going to ask this question is, what is the first cardinal sign? What is the initial cardinal sign which will occur in the Parkinson's disease? Okay. Remember the trick now, that one. TRBG. Please remember, guys. T means tremors, rigidity. What rigidity tell? Inflexibility, stiffness of a muscle. Okay. B refers to bradykinesia. Bradykinesia means slowing and execution of a slow movements. Okay. G means gait disturbance. Okay. Here the options will go. Bradykinesia. Second option is balance impairment. Hyperkinesia, dysarthria. Dysarthria you never heard in this disease condition. Dysarthria. What is meant by dysarthria? Difficulty in speech. No. Hyperkinesia. No. Hyperkinesia not. We are heard that bradykinesia will occur. Hyperkinesia means increasing in the movements, increasing in the work. Okay. This type of hyperkinesia will not occur in the Parkinson's disease. So that's please eliminate. Bradykinesia and balance impairment. Though both are the clinical manifestations of Parkinson's, but tremors, rigidity, bradykinesia, gait disturbance. Firstly occur bradykinesia. After that only balance impairment, gait disturbance will occur. Okay. So for that we should go towards this option, not this. Though both are the symptoms of Parkinson's, but the examiner is asking initial cardinal sign, early cardinal sign. Okay. For that all we should move bradykinesia. Okay. Next, move to our next question. Okay. When helping the client with the Parkinson's disease to ambulate, what instruction should the nurse give to the client? Okay. First, keep arms close to the center of gravity. Okay. Patient is suffering from Parkinson's disease. Automatically, patient is maintaining this type of posture. Always he is maintaining these hands in the center of gravity. Automatically, like this, we are maintaining these hands in the center of gravity, means automatically risk of fall is more. What? Risk of fall. Automatically injury will occur. That's why always we should help the client to maintain the arms side by the patient, not close to the center of gravity. Automatically close to the center of gravity means automatically risk of fall is more. That's why you should tell to keep the arms side by the patient. It will not go into the option for this question. Okay. Next, rest and tremors are experienced. No, in Parkinson's disease actually happening the resting tremors. What? Resting tremors. When a patient is in a rest condition, that time only tremors will come. Okay. It will not going to answer for this question. Okay. And hesitate between the steps. No. Because in the Parkinson's patient, what actually happens when the patient is going to like a steps like this. Very minute steps we are putting like this, one step here, one step. But in Parkinson's disease, patient is hesitating. I will put or not, I will go or not, like this. That's why you should encourage the patient to keep long steps, go long steps with long steps like that, but don't tell this hesitate between the steps. Okay, that will not go down. Avoid leaning forward. This is the exactly instruction nurses give to the client in further. Avoid leaning forward. Okay, na? What exactly? Patient is moving forward means automatically the risk of fall is more here also. Okay, that's why patient you should tell the patient to please avoid while moving, lean forward. Answer is this one. Next question. Which of the following is a commonly overlooked initial non-motor symptoms of Parkinson's disease? What examiner are going to ask this question is, which is the initial non-motor symptoms of a Parkinson's disease? But in Parkinson's disease, all motor symptoms occur. Very rare condition which will occur in the non-motor symptoms. But options, we will go through the options. After that, we will cog will rigidity. It will Rigidity will occur, you know, TRBG with that options, a trick given in that rigidity. Cog, two types of rigidity will happen in the Parkinson's disease. What? Cogwheel rigidity. Okay. This one, cogwheel rigidity. Rigidity means I told na, stiffness and inflexible. Okay. Next, akinesia. This is also a motor symptom. Cogwheel rigidity is a motor symptom. Akinesia. Akinesia means there is no movement. Okay, no movement, absence of a movement. What? Absence of an, this is also known motor symptom, but examiner is asking initial non-motor. What? Non-motor he is asking. Okay, bradykinesia, slowing of the movement. Okay, these all are motor symptoms. What? These are motor symptoms, but examiner is asking non-motor symptoms. Anosmia. Anosmia is a non-motor symptom. Anosmia means lack of a smell. Okay, lack of smell. These type of clinical manifestations are not seen in the Parkinson's disease. It is a non-motor symptoms of Parkinson's disease. Okay, this is the answer. Which clinical features does the nurse expect a client with a Parkinson's disease to exhibit? In this, select that all apply. Okay, all apply. Okay, what examiner is going to ask is, which clinical feature does the nurse expect a client with a Parkinson's disease? What are the clinical manifestations? What are the clinical features exhibited by the Parkinson's patient? Option is resting tremors, patterned effect, muscle flaccidity, tonic-clonic seizure, slow involuntary movements. Okay, in this more than one answers for this question. Okay, slow volunteer movements, it will occur because it will denote to bradykinesia. Bradykinesia will occur in this disease, na? It will going to an answer for this question. Okay, this one also is there. Slow volunteer movements, automatically patient will maintain slow volunteer movements. And next, tonic-clonic seizures. No, we have never heard that seizures will happen in the Parkinson's patient. No, it will not going to the answer. Seizure, what seizure is an abnormal electrical impulses, abnormal electrical firing in the brain that leads to seizures. Okay, it's not going to an options. Next, muscle placidity. Muscle placidity will not occur. Muscle rigidity will occur. Muscle placidity will not occur. Okay, placidity means muscle placid paralysis. That placidity means unable to contract. Okay, and next, flattened effect. This will denote to mask-like face. You heard. Okay, this will denote the mask-like face. While Parkinson patient is, you are communicating with the Parkinson patient means patient is not at all maintaining a facial expression while communicating with you. That's why they are telling that it is flattened effect, mask-like face. Okay, this is also going to answer for this question. Then resting tremors, automatically you know resting tremors will occur in this disease condition. Okay, what are the answers? Option number 1, option number 2, and option number 5. These are the clinical features of Parkinson's disease. Okay, next question. How the Parkinson's disease diagnosed? If one disease condition is, we should diagnose for that, na? Like this Parkinson's disease also, some of the diagnostic features are there. What are the diagnostic features? Okay, first one, blood test. Second option is neurological exam, finger to nose test. Third one is with X-ray. All of the above. Blood test will not diagnose to confirm Parkinson's disease. X-ray also not diagnosed to confirm the Parkinson's disease. All of the both no, because these two options were eliminated automatically. All of the will not will happen, na? That's why option is neurological exam. In neurological, finger nose test. Whose finger, whose nose? Finger is doctor's finger. Nose is patient who is suffering from Parkinson disease. Okay, while diagnosing this condition, some of the neurological examination, they will put on finger And what doctor will tell, you touch your nose and after simultaneously you touch my finger. What doctors will going to study about this means that bradykinesia. He wanted to rule out this clinical manipulation. That's why this test they are doing bradykinesia. Okay, because while he is maintaining that he is touching his nose and touching the finger of a doctor means automatically slowing up then process will occur. Automatically doctor will say that something slow means it will bradykinesia. And in other conditions also it will, in brain injuries also these type of investigations are doing. Okay na, option number 2. Okay, question number 14. Diagnosis of Parkinson's disease often delayed due to the fact of that. This is also select all that apply. Okay, select all that apply. What examiner are going to ask is diagnosis of Parkinson's disease, for which reason it will going to be delay. Okay, from here we will go. Its symptoms are characterized by frequent re-emission and exacerbation. Parkinson's symptoms are characterized by frequent re-emission and exacerbation. This type of re-emission and exacerbation will not occur in the Parkinson's disease. What is mean by re-emission and exacerbation? Exacerbation means worsening. What? Worsening or intensification of a symptom. Intensification of a worsening or intensification of a symptom of a disease. Any disease, that will called exacerbation. Okay, and what mean by re-emission? Disappearing or decreasing in the signs and symptoms of a disease condition. Signs and symptom of disease condition. This type of re-emission exacerbation not at all going to happen in Parkinson's disease. So that's why you should eliminate this option. Okay, next, symptoms manifest gradually. Okay, first slide one of the questions what we discuss how the onset happen or disease Parkinson's disease occur. In that question only answer it will occur in gradually. It will not occur suddenly overnight. Okay, it will not occur acute condition. It is a gradually occurring condition. It is one of the answer for that question. And it manifests in early adulthood. No, never we heard that in early adulthood the patient is suffering from Parkinson's, like that we are not heard. Okay, it will not going to answer. Okay, it manifests in a later life, thus early symptoms can be mistakenly attributed to normal aging. What here options is going to tell means it manifests in the later life. Automatically Parkinson's and dementia, Alzheimer's, these are the disease condition will occur in the old age people, later life. Okay, but what we are doing means, but we are mistakenly knowing that these are the process of normal aging. In normal we are getting age means automatically we are some of the aging process. For the aging process we are tremors. Aging process is slowing up the activity. We are thinking like, but it's not that. It will exactly happen in that Parkinson's disease. Parkinson's signs and symptoms, clinical manifestations are attributing. Okay na, clinical manifestations are showing. Okay, it's an answer for that question. Okay, these are the facts. Okay, next question. The nurse administered carbidopa levodopa to a client with a Parkinson's disease. Which therapeutic effect does the nurse expect about medication? The patient is suffering from Parkinson's disease. The nurse healthcare provider is administering carbidopa and levodopa. What are the therapeutic effect the nurse should expect? What are the outcome of a medication the nurse should accept? This is the one famous drug. What is that? Syndopa plus is a combination. What is Syndopa plus? Syndopa plus, it is a combination of carbidopa and levodopa. Why carbidopa? Why levodopa? Only levodopa means it will good na? Why carbidopa? Because why they are giving with the carbidopa and levodopa? Carbidopa 25 mg. Okay. Levodopa 100 mg we are giving. These two combinedly called Syndopa plus. Why they are giving with the combination? Because while taking this drug automatically our body has some of the enzymes, some of the metabolic process is going to happen. in that time what will happen, we are alone, we are giving this levodopa means automatically it will metabolize, it is deactivated by a body enzymes. That's why we are unable to give a concentrated drug, concentrated chemical dopamine to the brain. That's why we will give carbidopa levodopa, because carbidopa will neutralize it, carbidopa will metabolized by an enzymes, body enzymes. Automatically levodopa will remain, automatically levodopa will reach to the brain, it will restore the chemical that dopamine will restore. Okay, this will happen actually. That's why they are giving combination of drugs. Okay, this, remember this. Okay, we'll move to the options. Okay, increasing in the acetylcholine production. No, levodopa carbidopa will never increasing in the acetylcholine production, because it will increase the dopamine. What? Dopamine will increase. Levodopa carbidopa will increase the dopamine secretion, dopamine concentration, not acetylcholine. Acetylcholine will it will not going to increase in this condition. Okay, regeneration of injured thalamic cells. No, not at all. Carbidopa levodopa will not will going to do these works. Okay, no, there is no regeneration, no regrowth of an thalamic cells. Okay, these two options. Okay, improvement in a myelination of a neurons. No, there is no regeneration, there is no progress in the myelination of a neurons, it will also not occur. Okay, what actually happens, replacement of a neurotransmitter, none other than in the brain, that none other than dopamine. These two drugs will help us to increasing in the concentration of a dopamine in the brain. This is the answer. Okay, go to the next slides. Next one, levodopa is a common used drug in the pharmacotherapy of Parkinson disease. What is the mechanism of action? Examiner is asking mechanism of action. Okay, what the examiner going to tell? Levodopa is a common drug we are using, syndopa plus we are using for the treatment of Parkinson disease. What is the mechanism of action in the patient who is suffering from Parkinson disease? Okay, we will move to the slide. Stimulation of dopaminergic receptor. No, never ever it will stimulate the dopaminergic receptor. Dopaminergic means dopamine secreting receptors. Okay, dopamine making receptors. Okay, not going to do this type of action. Inhibition of dopamine breakdown. No, never, it will not inhibit the dopamine breakdown. Okay, it will also not going to the answer for this question. Okay, next, an anticholinergic drug that blocks the muscarinic receptors in the midbrain. No, not like that. Anticholinergic activity and muscarinic receptors in the midbrain, this type of actions will not done by the levodopa. Okay, but what dopamine will do, what levodopa will do, a dopamine, it is in levodopa is a dopamine precursor that crosses the blood brain barrier and promotes the synthesis of dopamine. This action will done by the levodopa. What levodopa actually does, I previous slide only I told now, it will cross the blood brain barrier. Dopamine is a, levodopa is a dopamine precursor that will help to cross the blood brain barrier and promote the synthesis of blood dopamine. Okay, this is the answer for that question. Okay, these are all not called. Okay, antipsychotic drug induced Parkinsonism is treated by, is also known as pseudo Parkinsonism. Antipsychotic drug induced pseudo Parkinsonism. Okay, pseudo Parkinsonism is also, pseudo means false symptoms they are showing. Okay, otherwise drug induced Parkinsonism you used to call. Examiner is going to ask antipsychotic drug induced Parkinsonism. What the examiner is asking, drug induced Parkinsonism, pseudo Parkinsonism, false Parkinsonism treated by which type of drugs? Okay, first amantadine. No, it is an antiviral medicine. What? It is an antiviral. Antiviral medicine. Okay, it is an antiviral medicine. It helps to dopamine synthesis in the brain. Dopamine synthesis in the brain. Okay, it is not going to treat the drug induced Parkinsonism. Okay, next, selaginine. Selaginine is a monoamino oxidase inhibitor. Okay, And it is also not going to, it is also we are giving this drug in the increasing the, it helps to increase the amount of dopamine in the brain. This is also helps to increasing the dopamine, but not in the treatment of antipsychotic drug induced Parkinsonism. Okay, this is also not going to. Levodopa. Levodopa also not, we are using that pseudo Parkinsonism clinical manifestation for this. Okay, levodopa is using for, actually we are using these all three we are using for Parkinsonism, not for pseudo Parkinsonism. Okay, we are using for Parkinsonism, Parkinson's disease. Okay, for not for that pseudo Parkinsonism, not for that false Parkinsonism, not for that antipsychotic drug induced Parkinsonism. Okay, we are using anticholinergic. Okay, anticholinergic, we are actually using the anticholinergics we are used to reduce the drug induced Parkinsonism, pseudo Parkinsonism. What actually happens means, in I am telling one, okay, we consider this one is brain. In brain, two type of hormones, chemicals, acetylcholine and dopamine. Okay, we have a acetylcholine 1%, dopamine 1%. After that, acetylcholine and dopa, and disturbance in the basal ganglia, disturbance in the midbrain, disturbance in the substantia nigra, disturbance in D2 receptor, automatically dopamine will half percentage, acetylcholine 1%. Okay, automatically unopposed action of acetylcholine, it will leads to Parkinson condition. Okay, automatically acetylcholine is a cholinergic chemical, it will cholinergic activity will increase, automatically tremors will occur. Okay, this type of actual method action will happen in this disease condition. Okay, but here what they are asking, antipsychotic drug induced Parkinson is treated by anticholinergic. Example, atropine. These are the drugs we are using to treat drug induced Parkinsonism, not levodopa, selagin, amantadine. These are using in Parkinsonism condition. Okay, next question. The nurse develops a teaching plan for a client newly diagnosed with the Parkinson's disease. Which of the following topics that nurse plans to discuss is the most important? While teaching plan we are discussing means, which of the following is most important? Okay, we will move to options. Okay, maintaining balanced nutritional diet. No, it's not an it is one of the teaching plan, but it is not any most important. Okay, still not going to answer for this question. Okay, enhancing the immune system, no, not that much important for this disease condition, most important. Okay, engaging a diversional activity, no, we are never diversional, because we are focusing on the reducing the clinical manifestations. We are learning some walking techniques, some of the techniques we are not diversional activity. Okay, but maintaining a safe environment is an option answer for this question. Why maintaining a safe environment? Because patient is suffering from gait disturbance, automatically risk of fall is more. It is the most important. Okay, the examiner is asking this most important. This also somewhat it will help the patient who is suffering Parkinson, but the most important is prevent from PAL, gait disturbance. Okay, okay na? This is the answer. These all are not answer for this question. Okay, the nurse observed that a client upper arm tremors disappear as he unbuttons his shirt. Which statement best guides the nurse analysis of the observation about the client's tremors? If Parkinsonism patient means automatically tremors will occur. But what the nurse is observing, while upper arm tremors will disappear, upper arm tremors will disappear while he will removing, unbuttoning of his shirt. Which statement guides the nurse to analyze his observation about this client's tremors? Okay, the tremors are probably psychological and can be controlled at will. No, not like that. In the Parkinson's disease, there is no any subject like a tremors will tremors will occur from psychological reason, psychological issues, not at all. And it will controlled by a will. No, not like that. It will not controlled by a will. It is an involuntary resting tremors. If the patient is controlled, means automatically will control, na? Why they are, he is not doing intentionally. That's why they are, it's not an option for this question. Because it's not an psychological, it's a medicine. Chemical dopamine will decreasing, not in a psychological. Okay, next, the tremors sometimes disappear with purposeful and volunteer movements. Okay, this is the answer exactly. Okay, the tremors sometimes disappear with a purposeful and volunteer movement, because the tremors will occur only in a resting tremors. It is the most clinical manifestation of Parkinson disease. But while doing the purposeful activity, automatically patient will turn towards rest to work. Automatically tremors will disappear now voluntarily. That tremors sometimes disappear with a purposeful and volunteer movement. This is the answer. Next option we see that the tremors disappear when the client attention is diverted by some activity. No, it is not a diversional activity. If you divert the patient, means automatically tremors will not stop. Okay, there is no like this magic will happen in these patients. Okay, there is no explanation for the observation. It is probably a chance of occurrence. This is a rubbish answer. Okay, there is no explanation for this. Why there is no explanation? These all are chemical, medical miracle happening. There is no explanation. We are telling means why. For that, this also we are eliminating these options. Okay. Next question. At what time of a day should the nurse encourage the client with a Parkinson disease to schedule the most demanding physical activities to minimize the effect of hypokinesia? Hypokinesia is slowing of a movement. Okay. First option, early in the morning when the client energy level is high. No, there is no mechanism like this. And early in the morning energy level is high. From at that time you should do, means it will automatically minimize the effect of hypokinesia. No, it's not going to answer. Next, when family members will available. Why? Healthcare providers are while family members will available, so automatically hypokinesia will reduce. No, not like that. Immediately after rest period. Why? After rest period means automatically energy will come, hypokinesia will disappears. Okay, this is also not for that question. To coincide with the peak action of a drug therapy. This is the answer. Drug therapy, dopamine, levodopa. Patient is taking a drug. While taking the drug, while the drug concentration, blood drug concentration, when the blood drug concentration peak level in the body, that time we should force to do physical activities. That helps to minimize the effect of hypokinesia. Okay, peak action of the drug, peak action, drug concentration. Okay, this is the answer. 22. Which goal is the most realistic, appropriate for a client who is diagnosed with a Parkinson's disease? First one, to cure the disease. No, not at all possible. There is no cure for this disease condition. No. Next, to stop the progression of disease. This is also not possible. We can't stop this disease condition. Okay, until your last breath, the Parkinson will be present. Next, to begin a preparation for terminal care. No, we will not preparing the patient for terminal care. It is not a goal. Terminal care we are giving a cancer patient, very sick patient, but this is we are using. Maintain optimal body functions. What optimal body function? We are maintaining daily activities, we are maintaining daily exercising, muscle strengthening. These type of maintaining body optimal body functions will help us. It is the goal for the most realistic, appropriate for whose clients suffering from Parkinson's disease. Okay. What is the primary goal? Collaboration established by the client with a Parkinson's disease, nurse and physical therapist. We are doing some treatment. We are collaborating with some department, nurses and doctors, nurses and anesthesia, nurses and physiotherapist. We are collaborating. We are giving collaboratively care to the patient. What nurse and physical therapist will do in this Parkinson's disease patient? Reduce the ataxia. No, ataxia will not occur in this condition. Ataxia is not maintaining. It will actually occur in cerebellum disease conditions, cerebellum related disorders. Okay, uncoordination, ataxia mean. Okay, not occur in the this condition. Improve the muscle endurance. No. To build a muscle strength. No. Physical therapist will not help to build the muscles. These are worked by gym workers, gym trainers will do these type of activities. Okay, but this will nurse and to maintain a joint flexibility. Okay, this is the answer. Helps to, because in the Parkinson patient rigidity will occur na, helps to maintain a joint flexibility. We are moving the joint, some of the exercise, range of motion exercise we are doing, abduction, adduction, flexion, extension. Okay, these type of, because it helps to maintain the joint will be flexible. Okay, this is the option. Okay, next question. A client with a Parkinson's disease prescribed levodopa therapy. Improvement in which of the following indicates effective therapy? First option, mood. No, by giving the levodopa there is no alteration in the mood. Okay, na? There is no mood changes, there is no mood elevation, mood diffraction will occur from the levodopa therapy. There is no role of mood. Okay, alertness. No, by giving the levodopa automatically Parkinson patient will alert like this, alert. Not like that. Any studies will tell that levodopa will increases alertness in the Parkinson's patient. It's also not. Appetite. No, these are levodopa is not an appetizer. Okay, appetizer means it will increase the appetite of the body. It will help us to eat more. Levodopa will not at all doing this. It will helps to improvement in muscle rigidity. Clinical manifestation you see in a TRBG. Muscle rigidity. This is only muscle rigidity. Okay, it will improve. This is the answer. Next question. A patient with a Parkinson's disease, at which time patient need to take tablets, regimen. We are giving Syndopa plus. In our ward, we are giving Syndopa plus 6 a.m., 2 p.m. These are regimens. 6 a.m., 2 p.m., 6 p.m. Okay. 6 a.m., 2 p.m. Two type of Syndopa. Syndopa plus also you are giving, but timing is different. Syndopa CR. Syndopa CR also coming. Okay, this but timing is, this one is we are giving 9 a.m., 9 p.m. At a bad time, no, not like that. All at one time, no, the drug overdose will happen. Okay, 2 hours before meal time, 2 hours, no, not like that. At the time of schedule, these are the schedules. I told now, these are the schedules. This time only we should take. That time only it will maintain the blood drug concentration. Okay, blood drug concentration. At schedule only. That's why we are not missing these tablets at the correct time. We are going and giving. The elderly client diagnosed with a Parkinson's disease has been prescribed levodopa carbidopa. Which data indicates medication is effective? One old age person is suffering from Parkinson's disease. Doctors prescribe that levodopa carbidopa drug. Which of the information will indicate that the drug will affect, the drug will reducing the clinical manifestations? We will know that the drug is doing its action in the body. Options. The client rotates the thumb and forearm finger together. This is the main clinical manifestation. But examiner is asking this question. Medication effectiveness he is asking. But here too, the client rotates the thumb and forefinger together. But still he is suffering from Parkinson's. There is no resolving of senses. We are not going to the answer for this question. Okay. And the client working with the shuffling gaits. Why? Patient not at all maintaining a gait, balancing gait. Okay. Now also his clinical manifestations are not. This is also not going to answer for this question. Okay. The client has a flat affect while talking. No mask-like face. No expression. Okay. No expression. No facial expression while communication. Not at all resolved. These are three options are exact opposite. It will not showing the medication effective. It is ineffective of a medication. These are all symptoms. But the examiner is asking medication effective here. The client has a normal arm swing while walking. Because the patient who is suffering from a Parkinson's disease, he is not at all maintaining arms swing while walking, because he is maintaining like this flexed portion and bend portion, lumbar curvature, neck curvature, and elbow flex and knee flex. These are the clinical manifestations actually. Okay, na? But in patient is maintaining normal or swinging while walking is somewhat reduced. Medication is effective. Medication is working is work. Its action. Okay, this is the answer for that question. Okay, next we'll move. A client with a Parkinson disease undergone a pallidotomy. Main goal for the client after pallidotomy is important. Some of the surgical interventions are going to taken while treating the Parkinson disease. What are deep brain stimulations? What are DBS? Brain stimulation, DBS. Stereotactic pallidotomy. Stereotactic pallidotomy. These are the two surgical interventions you will do in a Parkinsonism patient. Okay, for which purpose they did this? Okay, for which purpose they did a pallidotomy? What deep brain stimulation means? They are one pacemaker implantation. Okay, one pacemaker implantation. One will connect it to brain. Okay, this is our brain. Okay, one cord is connected to the brain and another cord in near the chest, otherwise neck. Okay, this is the implantation they will do. Okay, pacemaker, like we are doing in the heart pacemaker, like this pacemaker, it will helps to decreases the symptoms. Okay, electrical impulses it will reduce. And then next, stereotactic pallidotomy. What means one of the radiation pen we are using, by using that pen we will remove one organ part, globus pallidum. Okay, which is organ present in the brain. By removing this, we will control the tremors, rigidity, like that. Okay, but examiner is asking what is the goal for the removing of globus pallidum. Okay, appetite option, we will move to option number 4. Removing the pallidotomy, there is no correlation between appetite and pallidotomy. Okay, alertness, no, not at all. Alertness also, there is no correlations. Emotional stress, no, emotional organ amygdala, there is no relation this. Okay, functional ability will improve. Functional ability, activities of daily living is improved. Tremors will improve. Bradykinesia will improve. TRBG will improve automatically. This is the answer. Okay. Thank you. This much. End of an section.